Osteomalacia is characterized by defective bone mineralization, defective bone pain, myopathy, increased bone fragility and fractures. Osteomalacia is characterized by defective bone mineralization, bone pain, fractures, fragility and fractures of the bone, and myopathy. Defective bone is there, defective bone mineralization is happening, bone fragility, bone pain, bone fractures and myopathy is there. So all together we call it as a osteomalacia. Osteoporosis is something different. Osteoporosis refers to the decreased bone mass. Here the bone mass is decreased, but in the osteomalacia bone mass is normal, but mineralization is not happening. If a mineralization defect is there, that is malacia. If bone mass itself is decreased, mineralization is there, everything is there, but bone mass is decreased, that is osteoporosis. That is, osteoporosis refers to the decreased bone mass due to imbalance between the bone formation and bone resorption. If there is bone resorption and bone formation defective is there, then bone mass will be decreased, no? So if bone mass is decreased, it is called as a osteoporosis. Osteopenia is precursor to the osteoporosis. Osteopenia leads to the osteoporosis. You can just remember like this: osteoporosis is the part 1 of the osteopenia is a part 1 of osteoporosis, and osteomalacia is something different. That is defective mineralization. Osteomalacia is defective in mineralization. Osteoporosis is defective in absorption and resorption and formation defect. That is osteoporosis. Etiology of the osteomalacia are due to the vitamin D deficiency and phosphate deficiency. Here mineralization defect is there. No, what are the minerals, important minerals for the bone formation, bone mineralization? What are the important minerals? Calcium and phosphate. No, calcium, where does the calcium come from? Vitamin D, no? So causes are mainly two broad types: vitamin D deficiency and phosphate deficiency. Vitamin D deficiency, it can cause because of the deficient intake. If you don't take vitamin D properly, and if you are not exposed to the sunlight properly, and if you take also, if there is no absorption in the gut, that is malabsorption, and vitamin D have taken, vitamin D is absorbed, but the vehicle for vitamin D is not there, that is loss of vitamin D binding protein. Binding protein, where it get lost? In the nephrotic syndrome. Nephrotic syndrome protein will go out, no? So these vitamin D binding proteins will also go out of the body. So vitamin D is there in your body, but the vehicle for the vitamin D, that is vitamin D binding protein, is not there. So in that case vitamin D deficiency can occur. And metabolism of the vitamin D, defective metabolism, that is defective 25 hydroxylation in the cirrhosis of liver, defective 1 alpha 25 hydroxylation, that is renal failure. And if everything is all right, and if there is vitamin D resistance, then also vitamin D deficiency occurs. So altogether vitamin D deficiency are deficient intake, inadequate sunlight exposure, malabsorption, nephrotic syndrome where there is loss of vitamin D binding protein, cirrhosis where there is defective 25 hydroxylation, renal failure where there is defective 1 alpha 25 hydroxylation, and last is a vitamin D resistance. Second group of causes are phosphate deficiency. Because of the decreased intake of the phosphate, antacids, antacids causes the phosphate deficiency. Impaired renal reabsorption of the phosphate, that is Fanconi syndrome. So these are the causes of osteomalacia. Clinical features of osteomalacia. How will be the patient presenting to you when the patient has got osteomalacia? It can be asymptomatic, radiologically as osteopenia. It can also produce diffuse bone pain, diffuse everywhere bone pain, tenderness. If you touch bone, it will be tender. Muscle weakness will be there because myopathy is a component of the osteomalacia, as we have discussed in the definition, no? So that's why muscle weakness will be there. Mostly proximal muscle weakness will be there. Muscle wasting can be there. Hypotonia, fractures, bone deformities can occur in the severe osteomalacia of long duration. Investigation radiological findings are decreased bone density with a thinning of the cortex, changes in the vertebral bodies, loss of radiological distinctness of the vertebral body trabeculae, concavity of vertebral bodies, the codfish vertebrae, the vertebral disc appear large and biconvex, codfish vertebrae, concavity of the vertebral body increases, distinctness of the vertebral body will not be there, vertebral body trabeculae will not be there, you cannot distinguish the vertebral body trabeculae. There is codfish appearance of the vertebrae, there is increase in the intervertebral disc space, that is biconvex it will become, so that's why codfish vertebrae appearance will be there. And there may be spinal compression fractures. In another radiological finding is loser zones. These are pseudo fractures, fissures or narrow radiolucent lines and are characteristic radiologic finding in the osteomalacia. What are these? Pseudo fractures, fissures or narrow radiolucent lines and are characteristic radiologic findings in the osteomalacia. They are usually found at the femoral neck. These pseudo fractures, fissures or narrow radiolucent lines are found in the femoral neck, femoral shaft and pubic and ischial rami. The term milkman syndrome is specific to the osteomalacia. Milkman syndrome refers to the combination of multiple, there are lots of bilateral symmetrical pseudo fractures in a patients with the osteomalacia. Milkman syndrome is nothing but a pseudo fractures. Pseudo fractures are what? Pseudo fractures. How will be the pseudo fractures? Pseudo fractures are multiple and both side symmetrical. That means multiple means femur also affected, tibia also affected. So in if femur is affected on the one side, other side same femur is affected. If tibia affected is in right side, same area of the tibia is affected on the left side also. That is multiple means femur and tibia. Just example, okay, tibia and femur are affected, both, multiple. Bilateral means both sides, symmetrical means same areas of pseudo fractures are seen. Pseudo fractures, these are not true fractures, they are false fractures. In the osteomalacia patient, false fractures are seen, multiple, bilateral and symmetrical. This is called as a milkman syndrome. Low vitamin D levels will be there. Above are all radiological findings we have discussed in the investigation. Now we are coming to the low vitamin D levels, and another investigation is low vitamin D levels, hypocalcemia, hypophosphatemia, ALP level will be increased, bone density will be decreased, iliac crest bone biopsy is the gold standard for the establishing the diagnosis, but should be done only when the diagnosis is in the doubt. Underlying cause is treated in the treatment part. Underlying cause should be treated, hypophosphatemia treated, hypocalcemia is treated, treated and vitamin D deficiency is treated.